Hello, everybody, and welcome to today's Twitter Space. I hope you're all well on this Thursday afternoon, and welcome to another Twitter Space. Today we're going to be talking about what an Admiral Nurse is, what we do, why you should commission one, how we support Admiral Nurses, and answer any questions that you might have about that today. So welcome to you all. I'm going to shortly invite my co-speakers up to come and say who they are. But before I do that, I'm just going to tell you a few little bits about Twitter Spaces, how it works, so that you know. Don't know if you've been in a space before, so I'm going to assume you know little, but you may or may not have been. So the important things that you need to know today is how to let us know that you're here and to let us know that you want to speak if indeed you do. So you'll see a little button which has got a heart with plus. So it's usually down near the bottom of your screen if you're on a phone. If you're on a laptop or a computer, you won't have that feature, but if you're on a phone, you should. So if you look at your phone now and look at where the heart is and press down, you'll see a series of emojis, which means that you can wave to us. If you do want to speak, you can pop your hand up, and I can see some people doing it, fab. And you can put your hand up. So if you do want to come up and ask us a question, if they've got anything you want us to cover today as part of this space, feel free to use those emojis, and we will come and talk to you. Thank you. You can see lots of emojis going off there, so that's great to know people can use them. The other thing that you can do if you want to request in a more formal way is where you've got the little mic button down in the left hand bottom corner. You can hold that down and request the mic, and you can come up and talk to us that way. Anybody who does that today, we absolutely will try and bring you up on stage and try and have a conversation with you and see how we can help you and what we can do towards your question. So, without further ado, I'm going to invite my co-hosts who are here today to come up and say who they are. Just because of the order that you're on my screen, Caroline, can I go to you first to come up and tell everybody a little bit about yourself?
Yeah, thank you, Vic, for that. So my name's Caroline Scates. I'm Head of Professional and Practice Development at Dementia UK. I've been a very proud nurse of over 30 years now, registered adult nurse with a background in end-of-life palliative care mainly, and I joined Dementia UK about 5.5 years ago. So, yeah, really looking forward to sharing what I've learned around Admiral nursing to this point.
Thank you so much, Caroline. And Julie, can I invite you to do the same? Thank you.
Good afternoon, everybody. I'm Julie Allen. I'm the Head of Business and Service Development at Dementia UK. I've worked there for 6 years, and my background is commissioning dementia services. So I'm, really happy to be here with Dementia UK. My role and my team's role is all about commissioning new Admiral Nurse opportunities across the country.
Lovely. Thank you very much, Julie. I guess I should have introduced myself as well, which I neglected to do at the start. So I'm Vic Lyons. I'm Senior Consultant Admiral Nurse at Dementia UK. I've been an Admiral Nurse for I think it's 20 years this year, and a nurse before that, setting up services across central North West London and dementia services. Really proud to be doing this today. Equally, I love it when you said, Caroline, about being a proud nurse. I think super proud nurse is where we would both own that title, wouldn't we? And just it's a fantastic time to be a nurse. It's a challenging time, but a fantastic time, really exciting time, and it's great. So I don't know who's in the audience who is a nurse. If you're a nurse, do you want to give us a quick wave so we just get a bit of a sense of who's nurses in the audience, where people are coming from? But if any of you are out there who are nurses and you want to contact us afterwards if you're interested in finding out anything more about Admiral nursing that we don't cover today, please do. Equally, if you're a commissioner and you want to chat to us afterwards, please do. Or if you're just somebody who's interested, please feel free to ping us that way and get in touch. So I wanted to start off today by telling you a little bit about two things, really. One is about the title, Admiral Nurse. Why are we Admiral Nurses? What does that mean? And then also something about Dementia UK, because I think they're important things to share from the offset so that you get that knowledge to start with. So Admiral Nurses is a title that was given because of a family's experience in short. So the dad of the family was called Joseph Levy, and he had dementia and was a keen sailor. So his nickname was Admiral Joe, and the whole name of the charity and the Admiral Nurse name started because they wanted a direct legacy to their dad and their experience. Dad had vascular dementia, as I say, and what the family realised and noticed is actually not. It's not true to say Dad was okay, but Dad was in his place. But as a family, they had less support around them, who people could work with them, who could help guide them and support them and answer the questions that they had as a family. And the daughter of the family actually made a comment to the fantastic consultant, a lady called Monica Greenwood, made a comment to her that, well, it's actually us who need the nurse. It's us who feel we need the support, someone who can advocate for us and really work with us to help us support Dad in his dementia. And that consultant, I'd say, was fantastic, really amazing. She was actually the first consultant I worked with, so very small place in my memory, but she was great, and she could see the benefit of this model and this role. So agreed that actually there was this space for these nurses. And the title Admiral Nurse was a direct legacy to the family and to the dad and to actually their vision for what the future should look like. Out of that conversation grew a charity, because clearly one nurse working in that time, it was a mental health nurse working in mental health services in London, was fantastic, but actually obviously can only reach so many people, can only do so much work. So the model grew and changed, but you needed a charity to enable that to happen, to go out there and to spread the word and to raise awareness and to develop these nurses and to grow them. And obviously Caroline, Julie and myself all work for the charity, and that's our role, is around doing that. So Dementia UK, in short, it's a specialist dementia nurse charity. Our nurses, as I said earlier, are Admiral nurses. We as a charity are committed, and you'll hear more about this later on today, but we're very committed to growing, developing those nurses, making them the best nurses that we can do, to be able to really provide that support and life-changing care for families out there affected with dementia, because we know the difference that having somebody with you at times when you need it, when things are complex, to really be able to consider the person living with dementia and focus on them, but also focus and consider the needs of the family and the people who are supporting them. The other side of our role is also around advising healthcare professionals and working to make sure that wherever there's an Admiral nurse, the healthcare professionals in that area have got somebody they can access who can, give them some advice, give them some guidance, point out areas of best practice or evidence-based practice that they might want to implement, or indeed design strategies for their organisation and pathways. So quite a complex role, but you'll hear more about that later. I'm going to bounce to my co-colleagues here to see if either Caroline or Julie, either of you have anything that I've omitted in terms of either the history or what we do at Dementia UK that you'd like to add at this point.
Thanks, Vic. No, I think you've covered it beautifully. I think we'll probably talk a little bit later about the settings and areas that we have Admiral nurses hosted in at the moment. I think that might be really interesting. Also, a little bit about the clinical services that Dementia UK provide in terms of the helpline and the clinics as well. But I guess we'll come on to that later on. Yeah, you're doing a heart emoji, so I can see that's probably what you were planning.
Absolutely. Julie, anything you'd like to add from how I ambled into it?
I don't think so. I suppose I'm going to be focusing on people who might be interested in becoming an Admiral nurse and where those opportunities may be. But I'm sure you're going to give me an opportunity to talk about that as well.
Absolutely. That's 100% on the agenda for today. So as you'd mentioned it, Caroline, about how the charity and the role has evolved, and obviously I started talking a little bit about where we started, and it was mental health nurses within a mental health team. But would you like to tell us a little bit about that? Happy to do that?
Yeah, absolutely. Yeah. So, like you say, I mean, traditionally, Admiral nurses were registered mental health nurses. And identifying that people working with people living with dementia often fell and do fall still under mental health services, but we've moved, we've grown quite substantially, I would say, over the last several years. So now any registered nurse can be a Admiral nurse. So you might have an adult background, a registered general nurse background, a mental health background, or even a learning disability nurse registered background. And I think that's really amazing, because I think everyone that's registered in their own way has got so much to bring to the world of dementia care. So we were really excited to be able to expand that and really extend the reach of Admiral nurses. In terms of settings where you might find an Admiral nurse, so as we, Vic said with the charity when it first started to evolve, it's very much really based in the community. And lots of nurses were community based. But again, since we've grown over the years, we now have Admiral nurses in the acute sector in hospitals. We have Admiral nurses in care homes, in hospices, in primary care. It really is now, people living with dementia need support across the board. So it's really important that we can support Admiral nurses in the right places to be able to support the families that need them. So I think, having a variety of settings where Admiral nurses can now be found is amazing. And I know that Julie will talk about perhaps numbers and how many nurses we have now. I don't want to steal that from her, but that's a little bit about the types of nursing and actually where you might find them, if that helps.
That's tremendous. And I guess to add on to that, I would just say, and then we will definitely come to you, Julie, about numbers if you want to have a think about that, is that actually the role will differ slightly depending on where you're working. And
Yes.
and I think this is one of the things that's lovely is when we consider what does an Admiral nurse do, we know the kind of core skills and competences and the way that we work, but actually it will vary slightly. So obviously if you're an Admiral nurse in an acute hospital, you're going to be very inward facing, perhaps into that acute hospital and looking at the people who are there in that hospital for whatever comorbidities brought them into the hospital, whatever frailty, whatever condition. But also it's obviously about supporting those transitions and trying to not let people be in hospital on the point where they need to, and ideally working into a community to try and prevent people coming into hospital in the first place, and that would be very different to if you work in primary care or in a hospice, and so there is some variations in actually what the nurse does and the kind of duties that they get asked and pulled upon. And I can see Kerry in the audience, and Kerry is one of our acute Admiral nurses, consultant Admiral nurse for acute, so she knows all too well about the role in acute hospitals. But it's just to kind of, for anybody listening, to let you know that it's not that we do the same thing in every single setting. We would work with an area to try and kind of best match the needs. And you might want to say something about that, Julie.
Absolutely. So, not all nurses work in the same setting as Vic has explained, and the reason behind that is because we know our health system and social care system work, in that it's not the same all around the country. It's commissioned on a locality basis, and the challenges and the priorities for commissioners and healthcare providers differ depending on where you are in the country. So the nurses are often commissioned to deliver certain outcomes based upon local priorities. So if there's a problem in a particular area around, for example, transitions of care out of hospital, which is one of our big issues at the moment, and for many hospitals, we know that people with dementia often remain in hospital for a long period of time, and that's not a good place for them to be. Admiral nurses can support and help with that, and ensuring that people get to the best place for them as quickly as possible, and are not in hospital beds when they don't need to be. Equally, in other areas, it may be that there is a requirement to support GPs with diagnosing and looking after and developing care plans for families living at home. So Admiral nurses may get commissioned to do that in that particular area. So it depends on what the priority is in that locality as to what type of Admiral nurse is commissioned and what their priority and focus might be. And that's what my team do. They talk to the commissioners and potential hosts about what is it that they primarily need to solve in their area, and how could Admiral nurses help with that?
Fantastic, thanks Julie. So we mentioned a little bit ago about numbers as well, and how many Admiral nurses we've got. So I was asked the other day what number I was, because I've been around quite a long time, and I honestly, I'm not sure. I know somebody who will know, so I'm going to find that out. I know it was around the 30th mark when I joined, and we've grown massively over the years. How many Admiral nurses have we got today, Julie? or
We've got
to the best of your knowledge?
I know exactly that we have 330 Admiral Nurses today, but I also know that we have vacancies coming up of around 25 vacancies, maybe a little bit more than that. So although we only have 330, and I say only because that's nowhere near enough to allow everybody who needs access to an Admiral Nurse to get access to a nurse. 330 is quite a growth for us, and it will continue to grow. We expect to be recruiting an additional 50 nurses per year for at least the next 3 years, and more beyond then, but that's our target.
We're being ambitious and brave and bold with our targets, aren't we? Julie, can I ask you whereabouts the areas that we're looking at developing? Because it may well be that there's somebody in this space right now listening who's quite excited by that growth projection. And can you tell us a little bit about that?
I can indeed. I'll end up reading a very long list here, but I'm going to pick some out. But also, I think if I've done it rightly, I've tweeted into the nest. Or if I haven't, you can do it, Vic. A link
you
to
have.
our well, there you go. I've learnt a new thing today. So in the nest, there is a link to our Admiral Nurse job alerts, and you can sign up there if you're interested in becoming an Admiral Nurse and you want to be made aware of when our adverts go out, because we have adverts on our website all of the time. There are always posts there. So at the moment, we've got posts for a fabulous transitions of care acute post down in Plymouth that we're really keen to appoint to. That's a band 7 post. All of these posts that I'm going to mention are either band 7 or band 6 posts, but these are new posts that we expect to go out in the next few weeks, so you can watch out for them. Are you ready? Nottinghamshire, Norfolk, Warwickshire, Shropshire, Bedfordshire, Leicester, Wiltshire, Birmingham, Manchester, Liverpool, Northumberland, Leeds, 4 posts in Leeds, Bradford, Plymouth, I just mentioned. Amazing new service opportunity in Guernsey. We want 2 nurses in Guernsey. That will be our first service over there. Surrey. Numerous posts in London, Hammersmith, Harrow, Barking and Dagenham, Southwark, Richmond, Redbridge. We'll be going out to advert in the next week or so for an amazing new post, a Chinese speaking post, working in London, delivering Admiral Nurse clinics. And we've got other posts in central North London, central North London. I'm not sure which way around that goes. So you can see we've got a lot of posts, a lot of opportunities coming up in the coming weeks. A big recruitment drive.
That's some list. It's fantastic, isn't it? And I guess, like Julie said, anybody who's listening who's interested, wants to know when those posts are coming out, when they're live, do sign up for our job alerts, because then basically as soon as we've got the post and it's on our internet, we'll be able to let you know, so you don't have to constantly check and see. And the other thing that Caroline and Julie, obviously the Dementia UK account, we're really good at sharing posts as well as a team and other members of our team. So do follow people and look out for things so that we can let you know, and hopefully you can come and join us. I'm just going to quickly remind people, if you do want to come up today, feel free to request the mic and pop up and ask us any questions that you want to ask us, or make any comments that you might want to do, because we'd really like this to be an interactive space where you feel free to come up and join us and have a conversation with us. So I'm going to ask Caroline a question, I think, perhaps because you mentioned earlier on about how we've evolved as a charity and some of the work that we've done, because, obviously over the last couple of years, we've been evolving massively. Are you happy to talk a little bit about some of the evolution and the way that we're reaching and supporting people as a charity?
Yeah, absolutely. Maybe I can talk a little bit about the offer of support that's grown,
Yes,
as well, if that's
perfect.
okay. So once you become an Admiral Nurse, so you're right. I mean, we've grown hugely, which is amazing. And we always kind of say, the comparison would be, if you had cancer, you would want a Macmillan nurse, and for us, if you have dementia, we would like a family to have the support of an Admiral nurse, and that's really what we would aspire to. And to become an Admiral nurse, once you do become an Admiral nurse, well, I can talk a little bit about our general offer in a second, but for Admiral nursing, for me as a nurse that's worked in education for many years, it's an absolute joy to be able to offer the amount of continual professional development that we do for nurses. So once you become an Admiral nurse, and you will become a member of our Admiral Nurse Academy, which is newly formed and still being built. But essentially what that means is that you have access to a variety of professional and practice development opportunities that are provided by the charity, by Dementia UK. So alongside your host or whoever you're working and opportunities that you would have with them, you would also have quite a substantial offer of development for yourself. And that's evolved, like you mentioned, Vic, in the time that we've grown. So one thing we've always held on very securely to, I think, and we find very important in terms of making sure that nurses get the support they need, is clinical supervision. And that's going to mean different things to different people depending where you work. But for us, clinical supervision is around support. It's around a safe space, a confidential space, for you to bring cases, to bring challenges, as well as successes with your peers. So every month, every Admiral nurse has access to a 2-hour clinical supervision in a closed group with a group of peers, so other Admiral nurses that they form relationships with and get to know over the time they spend together. And that's facilitated by senior nurses at Dementia UK. So members of my team and the practice development team, members of the consultant Admiral nurse team, and other senior nurses that really get Admiral nursing and can really facilitate some of those tricky conversations that could be had. So that's one thing. And obviously with the event of COVID over the last 2 years, that's again evolved and changed, and that's now delivered online, and it works incredibly well, because what we found with nurses being based all around the UK, we can now link people together that really have got things in common to share. So we found that a really valuable move, whereas previously, we were kind of constrained by geography a little bit with those supervision groups. The other thing that we do, a massive thing we do, is we have our own online platform for learning and professional development as well. So all Admiral nurses have access to that, and we have regular discussion boards on Blackboard, which is our learning and development platform. We have monthly webinars on a variety of topics that nurses can join us. So they're very interactive. But the joy of actually now doing that online is that we can record them. So any nurses that don't actually manage to get there on that exact date or time can then catch up on Blackboard and watch the recording of whatever webinar we've had at that moment. So that's proving to be really valuable. We've developed learning modules on various topics around dementia care. We've got leadership courses. We have got communities of practice, which means we bring nurses together in their settings. So, for example, we'll have a care home and social care community of practice. We've got one for the acute setting, one for the hospice setting. So really what that does is give nurses the opportunity that are working in similar settings, or the same settings, but in different parts of the country, to come together and share good practice. And again, share the challenges, but also share the successes and what's going well, and they're really valuable. And something we're just starting to do and we'll be developing over the next few months are special interest groups, which again, we've got a variety. So as Julie says, we've got 330 nurses. There's a variety of topics that they're all going to be really interested in, and they'll better sign up to a special interest group that's interested in. So there might be something around learning disabilities, it might be around prisons. There's lots of different topics that people are interested in, and again, it's a way of connecting nurses together. And that's really what practice development often does, is it just brings nurses together to work together and to share good evidence-based practice. The other thing, so the wider than Admiral nurses, so Dementia UK have also started looking at what we can offer the wider community that work in dementia care. And we can put the link on. I can put the link on a tweet afterwards, or if I can work out the nest, Julie, I might try and do that in a second. But we have a pre-Admiral Nurse e-learning module, which is free access. It's on our website, and essentially what that means is anyone that's interested in Admiral nursing or just wants to understand what an Admiral nurse does. Even so, we're finding it's very popular with student nurses at the moment, or for other healthcare professionals who just want to learn a little bit more about person-centred, family-centred dementia care. And that's a free access module that just really helps understand the role and the offer of Admiral Nursing. And the other thing we did last year, which was really successful and we'll be repeating again this summer, is our summer school. And again, I can tweet about that when the dates are, well, the dates are firm, but we're just working on the programme. But summer school is open to all healthcare professionals across the UK. It's free access, and really it's a week of webinars delivered by Admiral Nurses, delivered by members of Dementia UK, and just gives people an insight to the work that we do. And again, if you can't make the dates or the time that we've got them, all of those videos will then be uploaded onto our YouTube site, which again is obviously free to access. So a really valuable resource, because we really want to kind of share the work that we do, and hopefully the little things that sometimes you pick up make a big difference. So we really hope that summer school enables better dementia care for some people. Does that cover what you were hoping I was going to cover, Vic, or is there anything that I've missed out?
I think that was a fabulous list, actually, amazing. And I guess some of the stuff to add in terms of ways we've evolved is some of the stuff we've changed as a charity as well, is around actually how we reach as many people as we can. So we've got many people will know about our helpline, and I'll equally try and share something into the nest about our helpline, where people can phone our helpline, they can access support that way, because not everyone, we'll talk a little bit more about this, but obviously not everywhere has got an Admiral Nurse, but anybody anywhere can phone our helpline and get some support that way. The other offer we've got is the closer to home clinics, so people can book a clinic. So you could go on our website today if you wanted to talk to an Admiral Nurse and request a clinic appointment with one of the nurses at a time that suits you, and we can then have an appointment with you that way. And that's another offer that we've got available. We've also just started a kind of policy campaigning arm of a charity where we're looking at actually what can we do to change the landscape, to kind of talk about the changes that we need to see realised, to kind of try and sort of think about things we can do to use our voices as a group of experts around dementia to try and make things that aren't necessarily to do with growing more Admiral Nurses, but are to do with actually making the world a better place for people with dementia. So that's some of the ways that we've evolved as a charity as well, because certainly at one point all we had the time and energy to do was focus on getting more Admiral Nurses in situ, and of course we still want to do that, but it's actually what else can we do as well. Julie, is there anything you'd like to add that either Caroline or I have missed at this point?
I have got something that I'd like to add before I forget it. If that,
You can go for that.
I'm not sure that you've missed it as such, but whilst you've been chatting, I've been having a little nosy as to who is actually online listening to us, and I noticed that there are a couple of football fans there, and I just wanted to mention, you may not be aware, but we are currently working with the FA to talk about how we support footballers and ex-footballers who may develop dementia in the future, and raising awareness about that. So there's been lots and lots of conversations in the press over the last few years. So just thought you might be interested to know that we're working with the FA there. And the other thing I noticed was that we've got at least one learning disability nurse on the call. And we haven't mentioned just yet the types of nurses that get involved in Admiral Nursing. So I thought it was probably worth mentioning that you don't need to be a mental health nurse to become an Admiral Nurse. You could be a learning disability nurse or a registered nurse as well. And we welcome those additional skills. And we do have some nurses that are specifically specialise in learning disability and dementia too. So I just thought it might be useful to say that. And
Very
then
useful.
you probably want to talk about LD, so I'll let you talk about that. But the other thing that I wanted to mention was, as well as providing services through the helpline and closer to home, we also employ some consultant Admiral nurses in-house who do focus on specialities as well. So we have two nurses that specialise in Lewy body dementia, and we will have new opportunities come in the not too distant future around frailty and young onset dementia as well. So there are opportunities to really drill down and specialise in particular types of dementia support that are needed. Thanks, Vic.
No, perfect. Thank you. And learning disabilities, it is my area of specialism that I'm passionate about, and it's fantastic because for the longest time we didn't have, we weren't really reaching people who had a learning disability, and and the whole considerations as to the how they age, what support they need, what their circles of support look like, through to how they even get a diagnosis in the first place. We really weren't dwelling in that space too much. Some of our nurses were working with people with learning disabilities, but it was more of a kind of ad hoc thing. So we have got our very first, well, she's been in post nearly 2 years now, Admiral Nurse, working entirely with people with a learning disability. And I will plug her again towards the end, because actually the next Twitter space we're doing, she's joining me and we're going to be talking about that. So very relevant plug for her and the way that she's working. It's just going to lead me to talk a little bit about demographics, because that's something I'm always interested in when I think about what is an Admiral Nurse, what do we actually mean in reality. And obviously it's a nurse, but at the moment we're about to do a census, which will launch in March, which will give us some really rich data about the kind of demographic makeup of the nurses and what they do during the day, and the kind of activities they get involved in, including who they are as nurses, what levels of education they've got, what branch they come through, and some other stuff about them and themselves as individuals. But at the moment, from the data that we took recently, we know that out of the people who responded, most Admiral nurses are females. Vast majority, I think at 89% of Admiral nurses at the moment are females. We would like to change that. We would like more men. I know that there's more female nurses than there is male nurses, but we would like to see an increase in our male numbers around the Admiral Nurse table. At the moment, most Admiral nurses would identify themselves as being white British. About 87% of them would identify that way, and then 4% as white Irish. So clearly there's a need there for more black and brown nurses to come and join the Admiral Nurse family, and to take on these dementia specialist roles and work with us around that, because we really want nurses who are representative, and there's no barrier, there's no reason why not. So of course we want to encourage more people to apply, and I think the Chinese speaking nurse is a very definite step in the right direction. But we really do need to look at the diversity of our Admiral nurses and try to encourage more applicants from as many different types of people as possible. Age-wise, most nurses are between about 35 and 64, seems to be the figure that people are ticking as being the kind of average age, with the highest group being between 45 and 54, which, given we're talking about people who've specialised in dementia and want to work in that way, in the band 6 and band 7 levels, it's perhaps not surprising that you're seeing people who are at that kind of age group themselves. Many Admiral nurses have caring responsibilities for themselves. Around about 62% of our Admiral nurses talked about them having their own caring responsibility, and that might be that they're a primary carer of a child, school-age child, or a child with a disability, or indeed it might be that they're a carer of a family member who's got dementia. And I think that's something that is perhaps not surprising, because if you think about the age group that we're in and where our parents might be, and it's perhaps not surprising that there is a percentage of us who actually have got direct family carer experience. I think that's the same for our staff at Dementia UK actually as well. I think quite a lot of our staff have got family members who are living with dementia, and that gives us quite a unique position, perhaps, that we're the dementia specialists in that space, but we're also living with this ourselves. We have loved ones who have dementia ourselves, which means you can really put yourself in that situation and that person's shoes quite easily. So I don't know if there's anything in terms of the demographics or the makeup, because it's a question we do get asked. What's your demographic mix is not an unusual question to be asked. But is there anything either Caroline or Julie you would like to add at that point?
Probably just to say that it's going to be ever changing, Vic, isn't it? I think as we grow, and like you say, moving from mental health nurses to adult nursing and learning disability registered nurses as well has really kind of opened the door for us in that respect, because we're obviously able to to take on nurses from all registered backgrounds, which I think obviously will change our demographic as well, I guess, over time. And obviously, as the aim is to have 500 nurses in the next couple of years. So I'm hoping, like you've already alluded to, that will mean we'll have a wider demographic of nurses, and probably just we've been talking about Admiral nurses as specialist dementia nurses, but just to add in that Admiral nurses really kind of work with families that are living with dementia, but also living with complexity, and can really kind of untangle some really tricky scenarios and situations. So there's lots of other brilliant dementia services out there that support families as well. So we absolutely work in conjunction with all other services, and referrals to Admiral nurses are normally the families and people living with dementia that are really struggling for whatever reason. So it's a very varied job, and again, like you said before, Vic, about depending what setting you're working in and what model of Admiral nursing you're working with, that can be very changeable. So I guess what I'm saying is, a really exciting role that's continuing to evolve. And I think with that will change the demographic of the sort of people we see applying for the posts. So a really exciting time for Admiral nursing.
Thanks, Caroline. Julie, anything you'd like to add?
I think the main thing I'd like to add is the fact that not only are we wanting to broaden our own demographics, there are opportunities specifically to be working in BAME communities. So over the next few weeks, at least 3 posts will be advertised that are requiring nurses with additional skills or even language skills as well. So I mentioned earlier, we're going to be looking for a Cantonese speaking nurse in the London area to work with the Chinese Welfare Trust and deliver clinics to that community. We're also going to be looking for a couple of nurses to work with diverse communities in Leicester and in the Black Country as well. So I think that's really exciting that commissioners are recognising that there is a need to support families with living with dementia in these communities, and that those communities actually need slightly different support. They need to talk to nurses who've got those specialist skills alongside those specialist dementia skills. I think that's the only thing I wanted to say. I'm sure there will be far, far more posts coming along as well.
Well, I'm going to stay with you for a bit if I can, Julie. So can you talk to us a little bit about, because there's a new exciting thing that I know is very early stage in development, which is around reach into prisons. Are you able to tell us a little bit about that? And then I have a question that I've been asked to ask you as well. So if you do that one first, and then I'll ask you the other question.
Yeah, that's absolutely fine. Well, it is really, really early days, and we are only dipping our toe in the water. But we have been talking to prisons around the country, and we were invited to join part of a bid to provide mental health services into prisons in Cumbria. And so that bid was successful. It's for millions of pounds, and we're only a teeny weeny part of that. But we're going to be providing an Admiral nurse to deliver clinics twice a month within that particular prison, and also to deliver educational support and training to the staff within the prison and healthcare staff that might be attending and visiting patients there. That starts in April, and it is only a small project, but it's really exciting that we'll be the first to get involved in something like that, and we do expect it to grow. And in fact, on the back of winning that contract, we've been asked to join that mental health trust in a second bid, which is at the other side of the country in Hull, in the Humber. And so if that's successful, which I sort of expect it will be, then we'll be delivering support into that prison by the summer time, I would say.
Fantastic news. Thank you, Julie, for sharing that. So the other question I wanted to ask you is being asked a question, which is, why haven't we got Admiral nurses everywhere? And I know you spoke a little bit about this earlier on, but why haven't we got Admiral nurses everywhere?
Well, it's a really good question, but they're not commissioned directly by the NHS as a set job, and they're not openly funded by the government in any way. So Dementia UK, our role is to promote Admiral nursing and to find those opportunities to commission nurses. And we were a very, very small charity until the last couple of years. So we were limited to the amount of awareness raising and the amount of setting up of services that we could actually do. And we have taken that at speed now and are creating more and more posts, and Dementia UK are actually investing money in posts as well to pump prime them, to give areas the opportunity to almost test out whether this service would work for them in their area. The aim being, of course, that they then become sustainable services that are funded either through the NHS Trust or local authority, or sometimes by charities themselves as well. And some are funded in the private sector, I have to say, as well, but they tend to be care home related posts. But it's quite simply that, the funding has to be identified and the host has to be identified, and then we have to work with the organisations to set up those services, because we want to make sure that they're high quality services, and deliver good quality support for families, and that we're able to continue to support and offer the training and CPD that those nurses need. So the growth is faster now than it's ever been, but it's not as simple as you want a nurse, you'll get one there tomorrow sort of thing. It really does depend on commissioning priorities and us convincing commissioners that the nurse can achieve the outcomes that are a priority in their area.
Fantastic.
Does that answer the question?
I think it does, and there's a kind of follow on from that, which is
Yeah.
if I was a commissioner and I wanted to commission a service, or if I was a nurse working in an area and I wanted my a post in my area, how would I go about sorting that out? How could I implement that? So it's kind of two questions there. So maybe if we do the commissioner one first,
Well,
and
I
then do
suppose,
the nurse.
absolutely. Well, the answer's pretty much the same to both, actually. And the first port of call would be to talk to a local development lead from my team. We have our own email address, so you can email us directly and I'll identify the right person to speak with you about what a service might look like in your area. But we do have some web pages for professionals. They explain how we commission services and what they might look like. So I'll try and drop that into the nest, but failing that, you can always email me directly, Julie.Allen, ALLEN, at dementiauk.org. And really, that we're happy to talk to anybody who thinks that an Admiral nurse may solve their support issues in their area around dementia care. And it may be that we decide an Admiral nurse is the solution. It may be that it's not, but we're quite happy to talk to you.
Fantastic. So we're coming up towards the end part of our session already, which they always go so fast. But I do just want to remind people that if you do want to come and ask us a question, please do. Feel free to do that. And you can also, as other people have done as well, you can, if you follow people, you can message people and ask them questions and let them know that way. The other thing just to mention at this point is that we have had a number of occasions where somebody has actually, we've met somebody, I've met nurses at conferences who, when you have a conversation with them, the role they're doing, the way they're working, kind of lends itself to perhaps that person being an Admiral nurse. And it's not always the commissioners who decide that that's the gap. It's sometimes the nurses and the teams and the individuals who actually go, do you know what, I've heard about this role and this is a role that I think I'd really like. There isn't one in my area, so let's have a conversation and see if I can kind of work out the business case to take this to my line managers, have those conversations. So sometimes it goes both ways, doesn't it, really, around how we set up services and what we do. You might want to say something at that point, Julie. It looks like you're off mute.
Am I still off mute? Can you hear me?
Caught you out there. I wasn't sure if you wanted to add something in at that
Yeah,
point.
no, I can indeed. I was just tweeting the email address. Yes, we can talk to nurses about maybe converting their role to an Admiral Nurse role, or how their role compares with an Admiral Nurse role. And exactly the same process, just contact us at business development at dementiauk.org, and we can look at what role you're currently doing and how that might match across to Admiral Nursing, and how we might talk to your manager and your organisation about whether Admiral Nursing might be a good fit for their organisation. And of course, the benefit of that then is that you then get all of the support and CPD and clinical supervision that Caroline talked about earlier.
Fantastic. Thank you, Julie. So I guess the other thing I'd like to tell you about, and we mentioned earlier on when we were talking, is about banding, because another question that we've been asked is about what band nurses are and how that works. And there's a myth that circulates around at times that all Admiral nurses are band 7 nurses. That is not true. So I want to set that myth firmly to flat now. We do have Admiral nurses who are band 7, but the majority of our Admiral nurses are actually at band 6 level. They're nurses who have to have some demonstrable skills in terms of working with people with dementia, with their families. They have to have a good degree of knowledge around that. If anybody's done additional courses and training, of course, that's the sort of thing we're ideally looking for as well, is nurses with that proven back catalogue or track record or CV that talks to real dedication and passion in terms of dementia care and supporting people. So the majority of them are going to be sitting at band 6. You do have Admiral nurses who are at band 7 level. They tend to be nurses who have either worked as a band 6 and then obviously could progress their career to band 7 level, or nurses who've come into it at that level. The band 7s are usually either one of two things. They're either nurses who are leading a team, so they might have a team of band 6 nurses who they are responsible for the line management, the support, the development, the clinical supervision of those nurses, and that's why it's a band 7 role. Or they might be a nurse who is the only Admiral nurse within an organisation, and it's around that level of autonomy and decision making and the level of seniority that nurse needs at that level. We do have some Admiral nurses who are at band 8 level in the consultant Admiral nurse space. Again, they tend to be nurses who are, as you would expect of a band 8, they're involved in writing policies, designing pathways, maybe in a national role, covering the whole of the UK, whether it's for a care provider or another organisation, or indeed a nurse who's managing a large team of nurses, and that's why their post is at a band 8. They might be involved in research developments that way. So there is that different structure of nursing, which means there's actually really nice career pathways. So somebody could join Admiral nursing at a band 6 level and progress the way through. And obviously we have nurses working at Dementia UK, so Caroline and I both have large team of nurses that we head up, and they're nurses who have worked long successful careers in either the NHS or charity sectors or educational sectors even, and they've come to work for us at Dementia UK because they're very keen in looking at how do we develop other nurses, how do we develop the services, how do we develop what we do. So there is a nice structure. There's a saying that goes around, which is once an Admiral nurse, always an Admiral nurse, which is a bit of a chuckle moment, but actually we've got good retention. We've got lots of nurses who join us as an Admiral nurse, and whether it's because of the support that they get, or whether it's because they've got an absolute passion and we recruit them with that absolute passion and they want to stay in that role, or whether it's a combination of reasons, but people stay in role, which is really, really good. It's not to say we don't ever lose Admiral nurses, because of course for all sorts of reasons people move on from careers, but actually I think we're very lucky and fortunate that we have fairly good retention for Admiral nurses, and equally for posts as well. We do. I know the numbers we've got at the moment, and it's not to say that if a service is commissioned, it's there forever, because sadly, unfortunately, commissioning landscapes, needs priorities change, and occasionally services do exist for a while and then not forever. But by and large, we do a fairly good job of holding on to the nurses that we've got and also the services that we've got. Caroline, you've been quiet for a while, so I'm going to come to you.
No, just one thing actually you said just then, Vic, actually I'd like to pick up almost about the career
Yes, please.
structure.
Yes, go for it.
I think that career structure is really important. I think, just to, and I talked a bit earlier about the development that you get as an Admiral Nurse, but just to reiterate, we're always looking to meet the needs of the individual nurse. So, we work with the nurses around their individual development plans. So if you come in as a band 6, like Vic said, the opportunities then to progress to other roles, band 7 or beyond, are certainly, would be within your grasp if that's what you wanted and that's what your career was taking you. And I think the other thing just to mention, I'm not sure we've talked about too much, is Admiral Nurse is absolutely work in teams in all the settings that we've talked about, but they also have a lot of autonomy and often work really independently, and that's collaboratively with families and other healthcare professionals, and really managing those complex needs. So it's a really challenging but very rewarding role. And what we see when we work with nurses that are developing through a career pathway within Admiral Nursing is that real sense of achievement and challenge. And I think the fact that Dementia UK as a charity can offer such a wide range of support, like we've been talking about this afternoon, really does help. And I think there's a really lovely community within Admiral Nursing. So, the 330 nurses that Julie mentioned that we have now in numbers, they all come together once a year as part of a forum that we put on. And again, that's virtually at the moment with everything that's happened over the last couple of years. But my goodness, it's really powerful. So having like 330 nurses all in the same space, sharing practice, learning, developing alongside each other, there's some real connections that happen, real great relationships that maintain. The other thing we always say, that nurses that come and join us have an induction, and the nurses that meet on induction are from all different parts of the country, working in all different varieties of models around Admiral Nursing, but they always kind of stick together and they kind of meet up in various spaces along their Admiral Nurse journey. So there's a real sense of community and support amongst Admiral Nursing. So I just wanted to reiterate that really, Vic, because I think that's something that's really struck me since I've been working with the charity.
So you're so right. It does. We often refer to it being a family or the home,
Yeah.
Dementia UK being home, but it genuinely does feel like that often, doesn't it? And you have all sorts of different characters and roles within a family or a home, and I think we're very much the same in Admiral Nursing.
Absolutely. I mean, it's a challenging job, and I think the fact that nurses are able to support one another is really testament to their passion for dementia care. And the learning, we're continually learning and developing, and I think that we do that better together. So that's really important to say.
Thank you, Julie. Any thoughts from you at this point?
I'm just wondering if anybody's got any questions, Vic.
Well, I was wondering that too, and then we have got another request that's come in. I'm just also mindful of the time, so I'm gonna bring you up on Reddish to, because I know that you've got your hand up to ask a question, but just really mindful that we've only got 5 minutes left, so hope we can answer your question within that time. You should now be able to speak. If you want to unmute yourself, you can ask your question. I've given you the mic, so you should be able to unmute yourself, Reddish.
Okay, I was just making sure. My question.
You're here.
My question is that I'm out of the U.S., but I have all of my prerequisites done for nursing, but I wanted to know if any of that would transfer over to doing nursing classes in the UK, or how that would, if that would be possible, or if it would just be something where I would have to move and start over.
That's a really good question, and it's one that I'm not 100% sure about. I'm wondering, Caroline, as our practice development, whether you would know the answer to that question about moving to the UK from abroad.
Yes, I mean, obviously, nurses, that's the one thing about nursing, isn't it? You bring a whole host of transferable skills wherever in the world you work. And, there are lots of NHS host organisations that actively recruit international nurses. So certainly something to look at from. And obviously, what we've talked about is about the host organisations being the employer. So any posts that Julie spoke about earlier that are advertised, it'd be certainly worth looking and seeing what the host organisation are offering, and if they are willing to support nurses from outside of the UK. I think it's probably a very individual case. So I think, it'd be a case of really kind of seeing what came up and asking those questions of the host, if you saw a job that you were interested in. But wouldn't it be great to extend Admiral nursing into other countries, though, Vic and Julie? Maybe that's an aspiration still for the future.
Yeah, it certainly is. I mean, at the moment we're Dementia UK, and we don't cover the whole of the UK, but we need to get and then and actually in some ways COVID has leveled some of that, because at one point we had conversations about having Admiral nurses in Madrid and all sorts of other places, and actually how would you get that nurse to practice development, how would we work with the host? But so not that there's lots of good things that have come out of COVID, but in some ways that kind of flattening has helped.
Yeah.
Julie, I can see your hand up. Is that you wanting to speak?
Yeah, I was just going to say, although we are Dementia UK, our helpline actually takes calls from all over the world. So we do help people all over the world, don't we?
Absolutely. I have spoken to people all over the world via our helpline, and anybody can access that. So anybody who needs support, and we try not to steer people who, if you were a nurse wanting to know how to become a nurse, obviously that's not really the right avenue for you to go through the helpline, but anybody anywhere can contact our helpline and get some support. Does that answer your question, Redditch? I can see your hand up again. Has actually got a supplementary question, or do you want to?
Is there supplementary? It was, can we bring credits over from abroad? Like somebody who's not got their nursing degree yet, can they get their nursing degree with you?
That's a really good question. I mean, obviously,
Just for getting a specialty.
Yeah, so obviously in the UK, all nursing registrations are registered with the NMC in the UK. So all registered nurses have to be registered with NMC. And I'm not sure. I think if you come from another country, I think there are transferable qualifications, but you would need to be a nurse in, have gone through nurse training in your own country, and then that would be a case with NMC to see if that was transferable or not. Because I think it's very variable depending on what other country you've trained in. But certainly, worth asking the question and finding out a little bit more from the NMC, which is our regulatory body in the UK.
Right. See, I've got most of my training before, but I want to actually get my full nursing degree in the UK. I don't want to start getting my whole nursing degree until I've moved to the UK. So I just wanted to make sure.
Yeah, it's probably I mean, the Nursing Midwifery Council, so they're our regulatory body, so maybe they've got a really helpful helpline, and email address it, or just if you just Google NMC, you'd get that information. It's probably just worth asking that question, I would say.
Perfect. Thank you so much, Caroline, for jumping in there as well and answering that for Reddish. So thank you for asking your questions as well today. So we're really in the last minute now, and I firmly believe in these things starting and finishing on time. So I'm just going to do a very quick thank you for you people joining us today. The next space that we're going to have will be at the end of next month, and that one we're going to be talking about learning disabilities and dementia, and considering all things to do with that, and again inviting people to join us to come and speak. Final thoughts. I'm going to ask both Caroline and Julie for at the moment. I guess my final thought is around the growth and the change and the way that we're reaching more people as a charity, and actually how incredibly proud I feel of all the work we've achieved at Dementia UK and of every single Admiral nurse out there, and we know the difference that the nurses are making for families, and get referred to as being a lifeline for families. So just a real sense of pride at the work that we're together achieving. So that would be my final thought. Caroline, I'll go to you first just because of the order you're on.
Yeah, thank you. So probably my final thought, it is an incredibly amazing career that you could choose if you're a nurse to want to come into Admiral nursing. As we know, dementia care doesn't always get the kudos it absolutely deserves and needs. So raising awareness around dementia care is really, really important. And becoming an Admiral nurse, being part of the Admiral nurse family that we talked about, and part of that those connections. If you're remotely interested about anything you've heard this afternoon, I would encourage the website's got all of our contact details on, so do feel free to get in touch with any of us to discuss any questions you might have, or obviously via Twitter you can pose any questions.
Thank you. Perfect. Thank you, Caroline. Julie, final thoughts?
I've just added up how many nurse posts there are going to be going out to advert in the next few weeks, and I said around 25, and it's actually more like 40. So because we've got multiple posts in some of those areas, but what my fight is more of a call, really. If any of you on this session today listening are interested in Admiral nursing and becoming an Admiral nurse, or you know somebody who is, and then please give them the information and get them to inquire or inquire yourself about these posts. Sign up to our Admiral Nurse Alert, because I'm going to be putting one of those posters up with that hand. We need you, we want you, but we're looking for really, really good nurses, and you know, come and take this opportunity. I don't think you'll regret it.
Oh, thank you. That's a perfect space to end on. Absolutely love it. And we will be sharing this recording afterwards, so we always record the sessions and share the information we've shared. So you will be able to find it on our website. So do feel free to share and tweet that. Lamin, I'm really sorry, I'm just about to close the space, so I can't bring you up because we need to close the space now. So we're right at the end of the time, so I really do apologise. If there's something you'd like to message me afterwards, feel free to do so, and I'll try and respond to you at that point. Thank you everybody for joining us today. Hope you found this afternoon interesting and helpful. Thank you to my speakers for doing this with me today. Really enjoyed your contributions and your time today. So thank you hugely both for that this afternoon. And thank you everybody again for listening. I'm going to end the space now. So thank you very much. Goodbye.